Hi, my name is Dr. Bela, dermatologist and cosmetic doctor of the Hogarth Medispa in West London. If you are watching this video, presumably it means that you have heard about the Safe Aesthetic Treatments campaign. In this video, I'm going to go through the declaration, the 19 points, and I'm going to discuss what they mean and what's their significance regarding the safety of your cosmetic procedures. So what you should do is to download the declaration, print it out, and give it to your practitioner during the initial consultation to read it and sign it for you. If there are certain points that they cannot or don't wish to fulfill, please discuss the possible consequences regarding the safety of your procedures. The declaration reads as: for the request of my patient, I hereby declare that I comply with the statements below. I understand that the below points intend to ensure that the aesthetic procedures are performed in a safe and effective way for the benefit of the patient. If there is a non-compliance regarding any of the points, it should be crossed over and the potential consequences to be discussed with the patient, whether he or she is happy to proceed. Point number 1. I am adequately trained to perform the proposed treatments, which are either dermal fillers or anti-wrinkle injections, in a safe and effective manner. So this is a difficult point because there is no objective standard for what it means being a practitioner being adequately trained. As I said earlier in other videos, there is no statutory regulation at all, so legally anybody can inject fillers into patient's face. But from next year, a level 7 qualification is coming, although this is voluntary, so it's not obligatory at all. But from next year, 2018, you can ask for a level 7 qualification, which means a good standard. Point number 2. I undertake continuous professional development, CPD, in regards to the above procedures. So for example, I am a member of the British College of Aesthetic Medicine and I have yearly appraisals there, and I need to collect 50 CPD points every year, and part of these 50 hours, 50 points should be regarding my facial aesthetic treatments. Point number 3. I confirm that I have in place appropriate cover in relation to my professional indemnity or insurance, which is appropriate to the nature and extent of the risk of my scope of practice. This point is important because it might be the only condition that can stop an untrained practitioner from treating, because if they cannot show adequate qualifications for the insurance companies, they can refuse to give proper cover for their procedures, but it doesn't mean that they won't treat without any professional indemnity. Point number 4. I am aware of the difference between chasing lines and the 3-dimensional indirect approach, such as 8-point facelift, MD coats, or similar regarding dermal filler treatments. This is a soft point which is more about the quality of the filler procedures than the safety. Chasing lines means if the patient comes with concerns about the nasolabial lines or the marionette lines, and chasing lines means if I put the filler into the lines where the patient has their concerns. In contrast, on the other hand, the 3-dimensional indirect approach means we know that the problem is not here, the problem is the volume loss around the cheeks and the face, and if we want to improve the nasolabial and the marionette lines, we don't put the filler here, but along the cheeks and along the side of the face and the jawline, which gives a lift to the face called liquid facelift, and we achieve the improvement of the nasolabial and the marionette lines indirectly in a 3-dimensional manner, and we don't put the filler into the lines, we don't chasing lines. Point number 5. I am aware of the possible complications for the above procedures, and I am trained and prepared to deliver appropriate complication management if it should become necessary. Basically, dermal filler and anti-wrinkle injections are safe, but complications can happen, and if it happens, the practitioners should be ready, prepared, and well trained to manage these complications. Point number 6. I have up-to-date CPR, that is cardiopulmonary resuscitation training. For example, in my case, it's part of my yearly CPD that I renew my CPR certification every year, so I know how to perform a cardiopulmonary resuscitation in first aid situations if it becomes necessary. Point number 7. I have suitable emergency equipment and medication in my office ready to use and within expiry date. Although they are very, very rare, but allergic reactions like anaphylaxis or vascular complications to fillers can happen, and when they happen, I need to be prepared how to manage these complications. So emergency equipment should be ready to use and within expiry. Point number 8. I use only original FDA-approved products within their expiry date for the treatment of this patient. So, as I said earlier, FDA approval requires a strict and controlled study assessing the efficacy and safety of filler products. On the other hand, in the UK and in Europe, filler products require only a CE mark, similarly to a ball pen or a toothbrush. So for this reason, it's very, very important to use only FDA approved, so really safe products in the treatment of the patient. So for example, myself, I wouldn't like to have in my face any fillers which is uncontrolled, even if they are cheaper than the FDA approved proper fillers. Point number 9. I store my products according to the recommendations of the manufacturer. So for example, certain anti-wrinkle injection vials should be kept in the fridge. Number 10. I plan the treatment based on the individual analysis of the patient's face or treatment area by taking into account the patient's concerns and my professional considerations. So every treatment should be individual and planned. So obviously it should be based on the patient's concerns and remarks, but myself as a professional, I assess the patient's face and I set up a treatment plan according to my findings and the patient's comments, and this treatment plan should be discussed, and if there is an agreement, we can proceed with the treatment. Point 11. My patient undergoes a proper consent procedure which entails the verbal discussion of the benefits, potential side effects and complications, alternative treatments, and the option when there is no treatment at all. Furthermore, discussing all material facts which might be important for the patient. My patient signs a consent form as part of the informed consent procedure. The consent process is a very important part of every medical procedure, where every possible aspect should be discussed and covered with the patient during the consultation, and finally the patient signs a consent form. Material fact is any piece of information which is sufficiently significant to alter a patient's decision. So for example, if there is a booked meeting or a social event for tomorrow, I don't treat the lips today because they're gonna be swollen for 3 days and it's gonna look obvious, so it's important for the patient. Point 12. My patient fills in a detailed and relevant medical history form, and I assess whether there are any circumstances which might be contraindication for the proposed treatments. So a thorough medical history form and its analysis is part of every medical procedure, and I need to assess every previous treatments, medical conditions, allergies, medications, everything. And for example, egg allergy can be a contraindication for anti-wrinkle treatments because it can cross-react with the albumin within the product, or cold sores should be considered when we are treating lips, for example, or any cod liver product or omega-6 or omega-3 makes the blood thinner, so they can increase the chance for bruising. Point 13. I have adequate measures set up to protect and store my patient's data safely and according to law. GDPR, which is General Data Protection Regulation, is coming in the UK next year, so safe storage and management of patients' data becoming more and more important issue. Point 14. I do clean the treatment area and its surroundings with appropriate skin disinfectant agents such as chlorhexidine or similar multiple times before the treatment and during when needed. Antisepsis during procedures has a paramount significance to prevent any infection, foreign body formation or biofilm formation. So for this reason, before the procedure, the hair should be tied back, makeup removed, and the skin cleaned multiple times to have a safe environment to work with. Point 15. I deliver my treatments from a sterile surface. Again, this point belongs to the previous infection control subject, and it's very, very important to keep a sterile environment during the procedure. So I'm working from a sterile surface like a sterile dressing pack. Point 16. I do not touch my needle or cannula on any non-sterile surface, for example gloves or hair, during the procedure. If it accidentally happens, I stop the procedure immediately and I swap the needle or cannula to a new one. So we need to maintain the sterility of our needles or cannulas during the procedure. So we shouldn't touch it to anything which is non-sterile, for example hair or non-sterile gloves or gauze that we have used before. So if it accidentally happens, because it can happen, in this case we should stop the procedure immediately and we should swap to a new sterile needle or cannula. Point 17. I do perform a proper aspiration, bubble is visible and holding for 3 seconds or more during filler treatments when I use a needle or a cannula smaller than 25 G and I inject below the subcutaneous fat layer. In case of positive aspiration, I dispose the filler and open up a new one. Pricing to be discussed with the patient. I think this is the most important point among all, because the worst complication can happen with dermal fillers if the filler is injected into a blood vessel. The gel travels with the blood and clogs the tiny end arteries and can cause the necrosis of parts of the skin, or in worst case scenario it can cause blindness. Usually, generally, dermal fillers are safe treatments in good hands, but we know about 28 cases when hyaluronic acid filler treatments caused blindness. So for this reason, a good practitioner needs a sound knowledge of anatomy, where to inject, where not to inject, a safe technique, slow injection, and aspiration. Aspiration, I think, is one of the most important things to do during a filler treatment. What does it mean? It means before I inject, I go in with the needle, and before I inject the filler, I pull back the plunger, and when I do this, a bubble builds up, and I hold it for 3 or 5 seconds, and if there is no blood coming back, then I slowly inject the filler. If the aspiration is positive, so blood is coming back to the syringe, it should be thrown away and the new one should be open, and then I can go on with the treatment. So this is one of the most important things, because with the aspiration I can physically check whether I'm within a vessel or not. So performing an aspiration is a very, very important part of any procedure. Point 18. I inject filler slowly and no more than 0.3 ml in one bolus. This point tightly belongs to the previous point, the safe injection technique. So slow injection and small amounts during one injection belongs to a safe injection technique. Point 19. I do not inject through my markings or infected skin. So as I said earlier, it belongs to the infection control section, so we cannot inject through any markings or any imperfection of the skin, so we can inject through only the properly cleaned and intact skin. So that's it. I hope it all makes sense for you. It's been a long recording, but I think it was a time well spent. If you have any questions or comments regarding this video or about the Safe Aesthetic Treatments campaign, you can contact me through my Facebook page or website, that is drbela.clinic. I think it's much better to be safe than sorry. This is a very important video, and I think that you should know about all these points and you should be able to protect your health if needed. Thank you for watching. Thank you for your time. Bye.